And what they found was that, that the forced breath capacity was less up to 171 days after radiotherapy. And then after this, then there was gradual recovery up until their last point of assessment, which was at 360 days. So a drop off because of the factors of radiotherapy, and that the maximum voluntary volume then was decreased right up until 360 days. So what they're then making a claim in their summary or conclusions from their study is that all breast cancer patients have changes to their lung function, which then brings me to this study. And so this is by some therapists from Poland and from 2019. And what they wanted to do was actually look at, which is where I'm heading, to the non radiotherapy beam to those organs, but the changes that are happening more surface. And so what they did was that they looked at the movement of the rib cage during inspiration and expiration. For the mastectomy group, then it starts as a discrepancy and it continues as a discrepancy at each line. It sneaks up towards one at line 2, and then at line 3, which corresponds to rib 5. And what they're saying is that that's about where the surgery line is, the mastectomy surgery line. Then there is a greater difference. So there will be less movement in the bones at between one side and the other. And again, at the 4th line, still a difference. So what are the reasons behind that change that they recorded in Poland of the bones not moving right? And one might be that if you have a look on the left-hand side, we have an encapsulated breast implant. And so if the skin is tightly onto the implant and the implant is tightly onto the chest, then it's going to change the amount of movement of the rib bones during in-breath, at rest, as well as the deeper breath when we require the bones to move a little bit more. So I'm going to summarize the areas that we'll be looking at in our second part of this, our practice session, and that I think that breath capacity changes, or the ease of breathing, when the rib cage is not horizontal to the pelvic cage. And so what I see is that the sternum, so the chest bone, is either sticking out or it can be sticking in. So the bone, in both of those situations, the bones are not in the right place. And both of those will change the ease of taking a breath during rest, as well as more noticeable when people are needing to take a deeper breath. The other changes that I'll be looking at are that the lower ribs might not be in the right position. What I see is that the lower part of the rib cage, say the last 3 or 2 ribs, curve out, and so they're flared. Now this